Hi students, this is Dr. Prassan Vij. I'm a faculty for obstetrics and gynecology at PrepLadder. I'm the head of department for reproductive medicine at St. Stephen's Hospital. Now this is the time when you're preparing for your exams. Your exam dates are in March sometimes, but please remember that this is that 60 days when you're going to get very worked up and very nervous that whatever you've done, is it enough for the preparation? Well, getting worked up is not going to get you a seat. But definitely remember, if you get too worked up, what is definitely looking as a very good, bright career for you, you might just miss it. Please remember, stay focused. Try to finish as much as course as possible, and then this is the best way to fulfill your dream. Practice makes perfect. But remember what my father told me, that perfect practice makes perfect. So this is the time when you're going to make your practice perfect. You're going to revise perfectly. You're going to use this time to make sure that what you read for the last 6 months to 8 months, you're going to put into practice and recall everything very brightly into the exams. Remember, somebody very famous said long time back that by failing to prepare, you're preparing yourself to fail. So this is the time that you prepare very well. Now remember that this is a time when all of us start getting a lot of thoughts in our head that maybe there's not much time. Whatever I read is going to vanish out of my head, and there is no much time for me to revise it, and as many number of times I revise is going to vanish out. So this is exactly where you're making it very hard on yourself. Please don't do that. You have enough time. All of us go through this uncertainty. It is very human to feel insecure. Also remember that some of you may have thoughts that that guy is reading very hard. He's going to definitely make it. Please, he's just as nervous as you are. Nobody's ever going to feel that he's very confident of these 19 subjects which are staring at all of us. So yes, he's just as nervous as you are. And please remember that some of you may be having a sick parent at home. Some of you may be having some financial problems. But please keep all of that in the back of your mind. Keep working for your goal as of now. Make sure that you have time for all the other distractions. But yes, the focus has to be on your ultimate motive. That is the PG entrance exam in the next 60 days. Yes, some of you may have thoughts that, why did I choose medicine as a career? There were so many things I could have done. I could have done engineering like my brother, and he is already earning much more than me. Yes, I know these thoughts come. Some of you feel that maybe even if I do this post-graduation in whatever subject I choose, I'm not going to make much money. Please, no doctor is going to starve. Remember this, any doctor I've seen in my life, he's doing well in his space. He might have specialized in any subject, or he might not have specialized at all, but he's still doing extremely well. So let this negative thought go out of your mind that you're not going to earn money. You're going to make more than enough for yourself and for your family and be comfortable. And yes, there's some of you who are going to think some other kind of things like, why did he not come to my life? Some of you are going to think otherwise, that why did he come into my life? Well, I know some of us youngsters are going through these kind of thoughts, and these kind of events keep happening in young people's mind. But then again, put all of this aside. Keep focusing. You have a lot to lose if you don't focus as of now. Okay? So yes, remember what not to do. This is what I always tell my students, that please do not buy any new books now. What you have on the table is more than enough. In fact, I want you people to concentrate on the final 19 books for the 19 subjects. You may have 3-4 reference books for all the subjects, but please narrow it down to that one final book in which you put your slips. So please read that one book finally, because you've been reading for all these years. To narrow it down to one book which you're going to read, it's tough, but try to do that. And please don't start to photocopy the notes of the other institute. You may get distracted by a friend saying that this particular institute is better than the one which you're reading. Look, whether you're from PrepLadder or Marrow or Bhatia or DAMS or any other institute, all institutes, they all try very hard to give you this knowledge. And I'm sure that all of them are going to give you that particular subject in good amount so that you can excel in that subject enough for passing this exam. So please don't start doubting your preparation. Please stick to that one particular source of information which you have, because in this last 60 days, if you start following another institute apart from the one which you've trained with, that is what is called disaster. There might be some fundamentals which may be a little different from what you have been taught. And who knows, you were taught the right thing and you start following something wrong. So please don't change your boat while you're in the middle of the sea. Please don't do that. Okay? And yes, Don't rest on your laurels. You must have done very well in your exams, as in final year of MBS, you could have topped. But yes, topping in MBBS doesn't guarantee your PG seat. And yes, don't think you're doomed because you never did too well in your MBBS. I have numerous examples from my class itself that the students who did not do well in surgery or did not do well in medicine, they did MDs and MSs in those subjects and they are now super specialists. So what happened in MBBS is no bearing on what you're going to do in your life. MBBS is a tough exam. In fact, we've been always told by the British Broadcasting Corporation that this is the most tough exam in the world. Compare it to anything, whether it is rocket science or whether it is MBA or it is engineering. The toughest exam to pass is the MBBS exam. So if you've not done too well at that moment, doesn't mean that you're not going to do well in your PG entrance exam. Take that thought out of your mind. All right. And please don't start reading the American and the British guidelines for everything which you're having a doubt. Remember, these guidelines are for super specialists. These guidelines for specialists who are teaching postgraduates and people like me who are teaching fellows in reproductive medicine. They aren't for you. Really, really, they are not for you because these guidelines change every 15 minutes. Americans say something, the Britishers say something, and they seldom are on the same page. And then you people are having a controversy about some topic, and you are in the search of all the information on the internet for that one MCQ, which is probably not properly recalled by your students. So yes, don't waste your time on these guidelines. What is important for you that if anything has come in a book, that is what is important. If it is there in an important book like Shaw's Gynecology or Holland Bruce Obstetrics, it is sense for you. If you have a doubt, you can also refer to books like Novak's Gynecology or Williams Obstetrics. Those are the reference books. But yes, beyond that, if you have got so many sources on the internet which are going to give you information, you're just wasting your time. Remember, the guidelines are important, but that is for people who are making books. So when you have your source as books, and then you have people like us to tell you what are the controversies and what is the best way out of these controversies, then you don't have to look any further. Please focus yourself to what is there in books and what people like us in various institutes have taught you. Please do not waste your time on guidelines, and please don't hope that the exam is going to get postponed. So far, it's been told, I'm talking about 15th of Jan, that the exam is going to be on 12th of March. If it is getting postponed, it gets postponed for everybody. Right now, you're preparing for 12th of March, and don't keep hoping that the exam is going to get postponed. Now, those who have read for 6 months and more, that's the ideal kind of preparation. For you students in this last 60 days, what I want, please revise all your notes. Please revise all those slips attached to these books. That is what I told in the beginning, that please narrow yourself down to that one final book for each of these 19 subjects. And then for that last 1 month, read the small subjects. The small subjects will give you the maximum marks. Everybody is going to read medicine, surgery, and gynae, but those are very big subjects and it takes time to revise them. So in that last 1 month, read the small subjects first so that you're able to finish more number of subjects and you get a sense of completion. And yes, in that last 1 week, please revise the stagings of all the cancers across all the subjects and challenge yourself. How are you going to challenge yourself? You're not going to just revise the stagings of CS cervix. You're going to ask yourself, what is stage 3B? What is stage 2A? And what is stage 2A2? So you're going to challenge yourself by asking a stage, because nobody is going to start asking you the whole stage of CS cervix. They're going to ask you one particular aspect. What is the vaginal involvement? What is the stage when there is vaginal involvement in CS cervix? That's what is going to come as a question. So challenge yourself with the stages. Whichever subject you're reading, just challenge yourself by asking that one particular stage. That is the good revision in the last 1 week. And yes, please read the tables given in your books. See the graphs. That is quick revision of the subjects which you've read very well in the last 6 months. And yes, for the last 5 years MCQs, since you've been preparing very well, you've done more than 6 months of reading, make sure that last 5 years all the MCQs have been done. And if there is any topic which you've not seen as yet, this is the time to finish that topic. Okay? Make sure you know everything about everything. That's the best kind of preparation. All right? Now, those who started just 2 months back, you should have started earlier, but never mind. You guys, 3 years MCQs for you. But make sure, apart from the NEET exam, You're doing also the questions of the FMG exams because they're asking you very good questions in that exam now. And if you have the time, please go ahead and read the INI-CET exam questions also. And very, very important, again, don't miss any topic which has come in these MCQs for the last 3 years. Remember, ask your friend because he started reading before you. Ask that in ENT, is there any topic which you feel I should have read and I have not read? Please ask him about that. Please, because they have done a good preparation and he's your friend, he'll be glad to help you. That don't forget to read about glucose tolerance test when you're going for your obstetrics exam because now they do the one-step test for the screening of GDM, isn't it? So please keep a good bunch of friends with you who are reading for the PG entrance exam. Now remember, one book for each subject. Now you don't have the liberty to have many books because you started reading very late. So keep that one book for subject and then maybe this is the time to invest in the rapid revision from PrepLadder because this is where you're going to get a quick revision of all the 19 subjects without getting into buying too many books. Because you've started reading for the last 2 months, you have some knowledge about everything and maybe this is a good time to invest in rapid revision. Now, those who started reading very late, that is today, you are very late. Well, it could be for whatever reason. You could be sick yourself. You could have had some family problems. I understand. All of us go through some tough times in our life. So if you started late, this is the time to start banking on your friends. Remember, some of the friends would have actually started reading much earlier and they would have narrowed it down to one set of notes. Please take that book and photocopy it. Start reading very fast immediately. Also, you could benefit by joining some institute which is giving you a crash course on the 19 subjects. There are institutes who start at this moment so that the ones who could not start preparing on time have a quick look into everything. And that's why precisely what we have, the PrepLadder Rapid Revision. Please remember, the PrepLadder Rapid Revision is something which you can use as a very important tool for finishing all the 19 subjects in good time so that you know something about everything. That is what I want people to understand, that something about everything you should know even if you're starting late because you may still have a good chance of cracking it up with your good luck. All right? And yes, what is my common advice to all students? Revise the small subjects before you start doing the big ones. Look, everybody reads medicine, surgery, gynae, PSM. These are the big subjects, and if you read them very well, you're going to get how much? Let's say from 30, you may get, if you read very well, you may get 24, 25. If you don't read them too well, I'm not saying that don't read the subject. Suppose you've not read your medicine too well, but because you've been a student of medicine, you may still manage out of 30, let's say around 18, 19 or even 20 with your some basic common knowledge. But if you've not read your ophthalmology, then out of 12 questions, you're going to get 0. And if you've read your ophthalmology well, then you're going to get 12 out of 12. Similarly, for biochemistry, forensic medicine, ENT, all these subjects, even microbiology, people neglect a lot because it's a tough immunology chapter or virology chapter. So these subjects, read them before you do the big subjects because these subjects, if you read them well, you're going to get 100% marks. Even if you read your surgery well, you may at most get 27 or 26 marks out of 30. You may still get some wrong. So please invest your time in reading these small subjects well. I tell this to everybody, all right? And then read that one subject which you feel is not a cup of tea. The one subject which you are very scared of. Like I was always scared of biochemistry. And when I was doing my PG entrance exam, I made it sure that I read biochemistry first. I bought some very small books, but I knew that these small books were working for somebody who was my senior and he did quite well. So I bought some small books. I did not get into Harper because it was too big for me to understand. So I made sure that by the time I write my exam, this was my strong subject. So that's what you have to do. Please challenge yourself. Please pick up that subject which you feel you're very weak at and you're scared of that subject. Take it up now. These are the 60 days where you can pick up that one subject, give it that 3 days, 4 days time, and you can conquer that subject. Don't be scared of that subject and forget it totally because that one subject is going to give you marks because you've never read it before. All right? And also remember, there are controversies which will stay till the time you write your exam. So there's no point wasting all that important time by discussing with multitude of friends and calling up so many of your friends, and they may have the same doubts about these controversies. For those controversies, precisely, we are here to help you. Where we meet on these forums, where we can meet on the emails. Please write to us and get these controversies taken care of for once. Now, please ask the teachers which you're related to. Suppose you are a PrepLadder student and you have a doubt in obs and gynae, you're related to me. You ask me whatever controversies are there. I might be correct in 95% at least. Maybe there are some 5 questions which I might not be knowing too well, but still 95% is more than enough for you. So please, if you have any doubts regarding these controversies, please write about them to me immediately rather than wasting your time. And just believe me and go ahead and write your exam. Because, like I said, 95% of times is going to be true. All right? And remember that make your reading time count. Whatever time you're sitting on the table, you're not whiling your time off to set the music right and the temperature right, and you are not going to waste your time thinking about the air should be coming from that end and there should be good light from that side. All of this should have been done long time back. Now when you sit on a table, start reading immediately, and when you're at your table, don't start looking on the ceiling and start thinking about your life from here on, and don't start thinking about what happened in your previous life. So when you're going on staring out that tube light, your book is looking at you and it is pleading at you that, hey, buddy, look at me. Your purpose was to read me tonight. So please don't waste that time by getting distracted by all of these things. For that 45 minutes when you sit, give these bursts, okay? Give these bursts of 45 minutes. For that 45 minutes when you're looking at your book, you're not bothered about the good light or the good temperature or the good music. For that 45 minutes, you're focused into reading. And do not get distracted by any phone call or for anybody who's calling you for a cup of tea. For that 45 minutes, I'm going to read so hard that it's going to hurt. Then after those 45 minutes, you can get up, take a walk, and maybe you recall what you read, or call a friend who's reading with you, just tell him what you read so that you can do a quick revision. After those 15 minutes, give another spurt of 45 minutes. So if you have these bursts of 45 minutes, that concentrated 45 minutes is going to make you read much more than sitting on the table for 8 hours. Okay, so 45 minutes, break, another 45 minutes, take a break, and another 45 minutes. If you keep giving these bursts, you utilize your time better rather than sitting endlessly on the table and whiling your time off thinking about so many things in your life. That's why I said, make your reading time count. Okay, now please discuss with your friends. Don't gossip. Okay, your friends sometimes have read before you this one particular topic. So call your friend up when you're about to read one topic and ask him, what are the most important aspects of this particular topic? And suppose they're reading about the preterm labor, and they're going to tell you that please don't forget to read about nifedipine and magnesium sulfate. And when you're reading magnesium sulfate, it's a neuroprotective agent. So when you read for the preterm labor drugs, you know that Maxelf, I'm going to read these things nicely. Then you're going to read the doses of Maxelf also nicely, so that when you finish and go and talk back to your friend, you can tell him the side effects of Maxelf and at what dose what side effects can come and what is the therapeutic level when cardiac arrest can happen with Maxelf. So when you discuss with your friends, things stay longer in your head for a much better recall. Please remember, discussing with your friends doesn't mean that he is going to do better than you, or you shared your knowledge so that your knowledge is going to get lesser and he's going to get much brighter. If you have these kind of thoughts, then you're not thinking properly, because when you read as friends, you help each other. Okay, so use your time to discuss and help yourself for the exam which is coming up. All right, so please give yourself the best kind of preparation, and I've rapidly told you many things in this short discussion which you should follow for this exam. But remember that whenever you are chasing your dream, this is the time when you should give the best efforts, the effort which is going to make you hurt. But in these 60 days, you can make it happen. It is not less time. 2 months is more than enough time to channelize your energy and bring the best outside for the best kind of results. All right? I hope that you do very well in your exam, and each one of you, I pray that you go and give the best in your exams and write back to me at this email and tell me that all you got what you wanted to do. All right? May God bless you.